Greetings to one and all. I am Dr. Muthiah Ramanathan, a medical director of Oxymed Hospitals. Today, in the event of World Heart Day, which is being celebrated every year on 29 September, I would like to give a insight about heart attacks. As we all know, heart attacks is becoming a major problem in Indian scenario. Heart attacks incidents are constantly on the rise, and the number of deaths happening due to acute heart attacks are also on the rise. So we can, now I'll let you know about what is a heart attack. The heart is a pump machine. It supplies blood to the whole body, and in turn, the heart also requires blood to function normally. So what does the blood carry? The blood carries oxygen, and if the heart doesn't get enough amount of oxygen, then it is deprived of the energy levels, and it forms a heart attack. So that area of the heart which doesn't receive the blood forms a scar tissue, and that area doesn't work properly at later stages. So this is how a heart attack happens. And once a heart attack happens, it might lead to a heart failure also. So what are the causes of the heart attack? Heart attacks can come because heart attacks happen because the blood vessels start to get blocked. The blood vessels blockages happen due to increased cholesterol in the blood, or due to sugar, diabetes, high blood pressure. Smoking is a major cause because for smokers, the blood vessels become very thin and they develop blocks at multiple places. The alcohol intake in excess also leads to heart attacks. So all these things are the causes of heart attacks. Now, next coming to what are the symptoms of heart attacks. Classical symptoms of heart attacks are chest pain. Chest pain starting in the left side of the chest, and it radiates to the left arm and to the jaw. But most of the patients don't get the classical symptoms. They get as a numbness, they get it as a stomach ache or gastric symptoms. They have a belching type of symptoms. So most of the patients confuse gastric symptoms with heart attacks and heart symptoms with gastric symptoms. So most of the times we tend to miss patients, and then they come to us at a later stage also. So we should always see to that we don't miss any patient coming with a heart attack, and we don't dismiss them as a gastric patient. So we have to be very careful in that also. So the symptoms, classical symptoms, happen to very less amount of patients only. So there also we get so much of challenges, and we'll have to keep the patients informed. So, and coming to heart attack preventions, we can prevent heart attacks if we have a healthy diet and a healthy lifestyle. So even now, if we start to have a good diet and a healthy lifestyle, we can make the heart attacks reduce heart attacks to a great extent. So what are the diets that are heart safe? So we should have the diet, balanced diet. We should consist of good amount of fruits and vegetables. We should reduce intake of red meat, dairy products, and we should not take junk foods. Preservative-laden foods should be avoided. Unsaturated fat can be taken, but saturated fat foods has to be decreased to the maximum possible extent. Salt intake also has a major role. So we have to, it increases the blood pressure. If you take more salt or preserved food, which is major ingredient is a salt, then the blood pressure increases, thereby it might tend to give you more number of heart attacks. So, and healthy lifestyle means you have to stop, if you are smoking, you have to stop smoking, and alcohol intake has to be stopped or brought down to a great extent. Exercise, you have to at least exercise 30 minutes for at least 4 to 5 days a week. Normal walking is fine. No need to jog, run, strain yourself to the comfort, to the range where you can without straining yourself. Normal walking, brisk walking also is fine. Normal walking is also fine. So you have to do regular exercise. You have to manage your stress levels. You should try to have very good sleep. Sleep also has a major role. If you don't get a good night's sleep, the next day is you will feel always tired, your stress level goes up. So sleep has got a major role to play in the health of the anybody, health of anybody. So not only to the patients, but to even for normal persons. If you have a good night's sleep, the next day is always fresh for you and you can do your job very well. So sleep is also a major concern. So we can have a very healthy heart provided we make the required changes. We have a good diet, make adequate lifestyle changes, and we can have a very good heart. And on World Heart Day, I wish everybody has a very good, everybody takes care of their heart and has a very good lifestyle. Thank you.